We are speaking today with Dr. Ann Liu. She is an infectious disease specialist with Stanford Healthcare. Thanks for being with us today.
My pleasure. Nice to talk to you, Ann.
Let's talk a little bit about adolescents potentially getting the vaccine. What do you know about the recent clinical trial that was done on younger people?
So Pfizer is having their authorization application reviewed by the FDA. What they found, and what we know from just their press releases, is that of the 12 to 15-year-olds in the clinical trial, about half of them were given the vaccine, half were given a placebo. And of the around 1,100 that got the vaccine, none of them got COVID. And of the approximately 1,100 who got the placebo, there were about 18 infections. So this represents a really dramatic vaccine efficacy. They also found that the antibody levels that were produced by these 12 to 15-year-olds were actually higher than what was seen in the 16 to 25-year-olds who were in the earlier clinical trials. And they said that the side effects were pretty similar to what was seen in older people. We will hopefully see all that data when it's released by the FDA after they've had a chance to go through it and they have their emergency meeting. And we're really hoping to be able to look through that data and be as optimistic as we felt after we reviewed the data for the original clinical trials in adults.
So how soon could we actually see adolescents getting the vaccine?
My understanding is that the FDA is having their meeting early next week, and that the authorization could happen at that point, and then adolescents would be eligible for the vaccination.
So we're talking kids 12 and up at this point. Is there any talk about younger kids?
So Pfizer has started their clinical trials for 6-month-olds to 11-year-olds. And my understanding is that they're going to be enrolling for several months. And the plan is that they would submit the data for authorization in probably early fall. So it'll still be a while for the younger kids.
Okay. And what would you say to parents who say, okay, I was willing to get the vaccine for myself, but I don't want to experiment with my child's health?
Well, I would say that once the clinical trials are done, the experiment has been done. So if you haven't enrolled your child in a clinical trial, then you will be able to look at all of that data when it comes out next week, hopefully, and take a look yourself, hear what your doctors say about it. And hopefully people will be able to decide on the merits of the data once they've had a chance to take a look at it and hear from their doctors about it. But it is at that point not an experiment.
Now, we have heard various things over the course of this pandemic about COVID's effects on children, mainly that it hasn't been as serious. Where are we at with that? Do we have any more information on number of cases for kids?
So there's a few different thing happening that we should be aware of. So kids are representing an increasing proportion of cases. So last year, mid last year, say, kids are about 3 or 4% of detected cases. Perhaps there were some other undetected cases that among kids that we didn't know about. But at that point, we thought kids were about younger kids were 3 to 4% of cases. But as time has gone on, especially as vaccinations have increased, kids are making up a larger proportion of cases. They are now around 22% of cases. And there's probably a few things accounting for this. One is that older people are getting vaccinated. So cases among people who are vaccinated have dropped. And so kids make up a larger share of the pie proportionally. Also, as things have started to open up, things like youth sports and families getting together have become much more relaxed. We know that indoor sports were part of the driver of cases in Michigan when they had their recent increase in cases. And also there are these more contagious variants. So I think that all of these things together are increasing the proportion that kids are making up of these cases.
Having children vaccinated is obviously going to get us closer to that goal a lot of health experts have put out there for herd immunity. But now we're hearing we may never actually get there. What's your thought on that?
Yeah, that was disappointing to hear. So the estimates of how many people needed to be vaccinated to reach herd immunity were based on the older strain. So we have these more contagious variants now, and so a higher proportion of people need to be vaccinated in order to achieve that idea of herd immunity. Although I want people to realize that it's not like this on or off switch. Once we get to that percentage, all of a sudden cases go away. It's really that as we vaccinate more people, the cases go down, and hopefully we get to a level where cases go down really dramatically. But it's also really heterogeneous. So if some places in the country have much higher vaccination rates than other places, then even if overall we have a high vaccination rate, the virus can continue to circulate in the places where they have pretty low vaccination rates. And as long as it's circulating in those places, it can always go anywhere else where people are traveling. And that's just not just for the US, that's, globally, that as long as it's circulating somewhere in the world, we can't shut off our borders. We're not an island. There's the possibility it would come back to places where there are a lot of people who are vaccinated. The nightmare scenario would be if a variant pops up in one of these places where the virus is really actively circulating in significant numbers, that a variant pops up that that can get around the vaccine and then spreads back into communities where there are higher vaccination rates. Remember that if the virus is not spreading, if it's not replicating, it can't mutate. But as long as it's circulating somewhere, it has the capacity to form those mutations. That would be the nightmare scenario.
Right, because that would affect even the people who are vaccinated potentially.
Yeah. And so we're, really still a long way from any kind of herd immunity idea. And so we really need people who have been vaccinated to share their stories with friends and family, especially those who are living in places where vaccination rates are low, because for a lot of people, and I completely understand this, the mounds of data about vaccination rates and vaccine efficacy are not going to be as compelling as hearing from somebody they know, somebody they care about, telling them that the vaccine was okay and they did fine, and the reasons they got it. So people, share your motivations, hopefully, with friends and family.
All right, Dr. Ann Liu, infectious disease specialist with Stanford Healthcare. We appreciate your time.
My pleasure.